Hey guys, Nurse Alyssa here. Today we're going to talk about Aquacel AG, so Aquacel with silver. But before we get started, if you could hit like and subscribe, it would be greatly appreciated. So let's get started. So Aquacel causes a destruction of biofilms, and the ionic silver manages bacteria. So this prevents biofilms from reformating. So there's two layers stitched together for extra strength when it gets wet from the exudate coming into it. So when the exudate gets into the Aquacel, it forms a soft gel that contours into the wound. Indications for use. So we're going to use Aquacel on moderate to heavy exudating wounds with signs and symptoms of infection, or if the wound is suspected of having a biofilm. We can also use Aquacel as a prophylactic to prevent infection in clients who are at high risk for developing an infection. Contraindications, so we are not going to use this on clients who have a sensitivity or allergy to silver or sodium carboxyl methicellulose. We're not going to use silver products with petroleum or paraffin products, so we wouldn't use this with Adaptic. And we're not going to use silver in clients who are undergoing an MRI or radiation therapy. So if they do have an MRI or are undergoing radiation therapy, we can use the product, but it just has to be removed and replaced for when they're going in for the therapy. So we would take it off when they go in and replace it when they come out. So you're first going to prepare the wound base by cleaning it with normal saline, and you're also going to clean the peri-wound, getting rid of any debris that might be there, and then you're going to dry the peri-wound area. So then the Aquacel can be cut, but you want to make sure that it is overlapping the peri-wound by at least 1 centimeter. And if you're going to use multiple layers of the Aquacel, you're going to make sure each layer is out by 1 centimeter. So the first one will be covering the peri-wound by 1 centimeter. The next one will be covering the peri-wound by 2 centimeters. If you're using this as a packing, you want to make sure that you're only using one ribbon. So it does come in squares, so you'll kind of go around cutting it, making sure that you're only using one ribbon, and the ribbon does stick out by about 2 centimeters out of the wound for easy removal. We're going to use the forceps to remove the Aquacel in one piece. Sometimes there is a little bit of gel left in the wound, so you want to make sure that you clean that out very well with normal saline. So the frequency of the dressing change is going to be a max of 7 days, depending on the exudate in the coming out of the wound, but it can stay in place for up to 7 days. Now, the expectations of Aquacel is that the signs and symptoms of infection, so this would be just a localized infection, would be gone within 2 weeks. And if we're using it prophylactically, there's going to be no infection that occurs. And also, so we're using this as management of exudate, so we want to make sure that if it's working properly, there shouldn't be any maceration to the peri-wound. So that's all I have for this video. I'll catch you next time.